Hi, I'm McKenzie Redd. I'm a physical therapist here at Center for Physical Rehabilitation, and I want to talk to you about our pelvic floors. The pelvic floor is a part of our body, and it's something that we don't often think about until something goes wrong. Usually, our bodies just do our thing, and our pelvic floor is working for us without thinking about it. But pelvic floor dysfunction is common, especially among women. 1 in 4 women will experience stress incontinence in their lifetime, meaning they aren't able to control urinary leakage. And that is common, but it's not normal. And pelvic floor therapy is something that can help fix that and address that dysfunction. Our pelvis is a region of our body that has ligaments and tendons and muscles, just like anywhere else, but it also holds those muscles at the bottom of our pelvis. Our pelvic floor is layers of muscles, and it actually holds our abdominal organs up and provides sexual function and bladder and bowel control. So if anybody is ever experiencing pain with intercourse, or they have frequent urinary urges or constipation, or they have an inability to control their urine as far as sneezing, laughing, coughing, running, jumping, those are all signs of pelvic floor dysfunction, and pelvic floor therapy can help with that. Pelvic floor therapists are trained to be experts in the musculoskeletal system, so they can look at all of the different areas in the body that can affect the pelvic floor, including our hips and our low back and our maybe our trunk and our abdominal wall. They also are trained to look at the pelvic floor muscles themselves, and if those muscles are too weak, they can help with strengthening those muscles, and if those muscles are tense and not doing their job appropriately, working to relax those muscles in order to achieve that good pelvic floor balance. So some common reasons that people experience pelvic floor dysfunction can be a result of recently having a baby, so going through childbirth. Can also be changes that come along with menopause or aging. Sometimes it's because we hold a lot of tension in our bodies, and we hold those muscles really, really tight, and we haven't ever learned to relax them appropriately. So there's a variety of reasons that we can experience pelvic floor dysfunction, but a pelvic floor therapist can help really pinpoint that cause and find you a direction in helping solve it. So if somebody is experiencing pelvic floor dysfunction but doesn't want to address it, or for some reason hasn't addressed it, typically symptoms will just continue, or they may worsen over time. We have women that come in their 80s sometimes and mention that they've experienced peeing their pants for 60 years, or that they've never been able to tolerate having intercourse because it's been so painful. And to that I say there's no reason that we should ever have women or men that experience any of that pelvic floor dysfunction. Pelvic floor therapy is always an option for a treatment to help that. And so the earlier you get in, the better it is, and the easier it is to correct some of those problems and reasons for dysfunction. Someone can expect on their first visit to physical therapy to have a musculoskeletal exam, meaning we want to look at all of the areas of the body that could be contributing to that pelvic floor dysfunctioning, including that low back, the hips, the knees, the neck, different areas like that. So we'll typically have somebody come in, we'll look at their past medical history, what kind of surgeries have they had in the past, have they had any children, those sort of questions. And then we want to do an exam, and that includes looking at those muscles and joints on the external surface, and then also an internal examination, which is similar to an exam that a woman would have at the gynecologist's office. And then we want to look at those muscles. We want to look at the tone. We want to look at the strength, the coordination. Are there any muscles that are tender? Because that can give us a better picture and idea of some of that dysfunction. Most women, or most of our patients that come in for pelvic floor therapy, typically come to see us once a week for about 45 minutes to an hour appointment. We also, if need be, we sometimes see them on a 2 time a week basis. And typically we want to see them over the course of a few months. For some simple cases, maybe it's urinary urgency and you go to the bathroom really frequently and you can't go more than 20-30 minutes without going to the bathroom. That typically resolves within a few weeks. For more complex cases, maybe there's a prolapse, maybe there's been a lot of trauma to that pelvic floor. That can be more of a case of 8 to 12 weeks. I would say typically most people fall into the range of 6 to 8 weeks of treatment. So this is our pelvic floor model. And I love that it displays, that it has those tendons and ligaments, and then we're also looking at those muscles. And this is that pelvic floor, those layers of muscles that hold up our abdominal organs and the contents, and also provide support to hold that urethra closed when that bladder is full. We also have right in here our bladder, we have that uterus, and then back behind our colon, so you can see how closely all of those organs relate into that pelvic floor. So the pelvic floor has primarily 2 different regions. We have the urogenital triangle, which is the muscles in the front half right here. And those muscles really control our urgency. They help control our continence. So if we have trouble holding in that urine when we laugh or cough or sneeze, these are typically those muscles that we want to address. Back here we have that levator ani. So it's a group of muscles that act as a mini elevator for our organs. So when they contract, they actually lift those abdominal organs, and when they relax, we get that relaxation. Both play important parts to that pelvic floor health and quality of function, and we want to make sure that both of those areas of the pelvic floor are coordinating with each other and are both working to provide that function that we need in this region of our body. Pelvic floor dysfunction is very common among men and women, but that doesn't mean that we have to live with it. There's no reason that you should live with symptoms like having to go to the bathroom very urgently, losing control of your bladder, having pain when you go to the bathroom, feeling like you're not emptying your bladder completely, or pain with intercourse, or any of those symptoms. Those are all considered pelvic floor dysfunction, and that is something that physical therapy can definitely help with. So if you have a question about pelvic floor physical therapy, if you feel like that's something that you suffer from or struggle with, please come in to talk with us and see us. We can definitely help you and help you find better quality of life.